Welcome to this explainer. Look, if you or someone you love is navigating the TTC, trying to conceive, journey, you know exactly how all-consuming and frankly paralyzing the frustration can be. The human desire to reproduce is completely innate, but when it doesn't happen right away, the path forward often feels incredibly confusing. So today, we are transforming Dr. J. Aldegue's evidence-based clinical guide into a clear, structured compass for you. We're going to break down exactly what you need to know, from early medical intervention and lifestyle reviews to the balance of faith and action and practical tips for both partners. That way, you can stop guessing and start taking decisive, informed action.
Okay, let's dive into this. And right off the bat, I want to validate what you might be feeling right now. In a study of patients attending a UK clinic, a staggering 30% of couples had either the man or the woman on antidepressants, and that was purely due to the sheer distress of fertility difficulties. If you're feeling overwhelmed, stressed, or just emotionally drained by this whole process, this number beautifully illustrates that you are absolutely not alone. The emotional toll is profoundly real, and for some, it even leads to relationship breakdowns. And Dr. Adungahe points out that globally, the societal pressures here are just immense. In places like Nigeria and across Asia, affected couples, and especially women, are frequently ridiculed and sometimes even rejected by their communities. Add the financial strain to that. In Nigeria, fertility care can be totally uncoordinated and unaffordable. And in the UK, NHS funding often falls woefully short of the recommended 3 IVF cycles. Ultimately, as Dr. Adungahe notes, couples are left wandering this journey without a compass or compassion and without financial aid. And that is exactly why this roadmap is so desperately needed.
To give you that compass, here's our agenda for today. We'll be covering navigating the TTC journey, timely medical intervention, optimizing your lifestyle, intimacy without the stress, and finally, balancing faith and action.
All right, Section 1, navigating the TTC journey. And really, it all starts with getting quality information. Let's just quickly acknowledge the massive hurdles out there. Whether you're facing societal ridicule, battling depression, straining a relationship, or trying to figure out how to afford uncoordinated care or navigate insufficient NHS funding, these obstacles are very real. But hey, recognizing them is exactly how we start to overcome them. The whole goal of this explainer is to empower you to navigate right around these roadblocks with solid clinical facts, not just anecdotes. So let's move to Section 2 and see how this builds. Timely medical intervention. The absolute key takeaway here: please don't delay. Dr. Adungahe lays out a really clear timeline for seeking help. Basically, if you're under 35 years old and have been trying unsuccessfully, you should seek medical advice after 12 months. But take a look at the right side. If you're over 35, that window drops to just 6 months. Seriously, do not delay. And when you do go, ensure your doctor is running the right tests. We're talking hormone checks and fallopian tube evaluations for the woman and a comprehensive semen analysis for the man.
We also have to tackle those cultural myths head on. We all know the story, right? The aunt or the neighbor who miraculously conceived naturally in her mid-40s. But Dr. Adungahe warns us to be realistic here. Female fertility actually peaks around age 23, and it starts a significant decline from age 37. I mean, yes, Sarah in the Bible conceived in her old age, but Dr. Adungahe bluntly reminds us, you are not Sarah and your husband is not Abraham. Relying on those rare exceptions completely ignores medical reality, including the fact that conceiving in your later years carries a much higher risk of chromosomal abnormalities for the baby.
So when you decide it's time to seek help, I want you to use this medical checklist. Keep in mind, not all doctors have the training or experience to treat fertility problems. First up, verify they are actually a qualified gynecologist. Second, check that they have the facilities in place for the necessary tests and treatments. And honestly, be bold. You are your own best advocate here. Demand that your test results are explained to you in plain English. Refuse to be blinded by confusing medical jargon. Ask them directly about their success rates, their complication risks, and how many cases they've successfully handled.
Moving on to Section 3, optimizing your lifestyle. Let's look at building some really healthy habits. For the female partner, maintaining a healthy lifestyle is your baseline requirement. If you're carrying extra weight, try to focus on losing it and keeping fit with moderate exercise. Now, diet-wise, the ideal fertility-enhancing setup should actually be low in carbohydrates. You'll want to cut way back on red meat while actively increasing your regular consumption of fish, veggies, and fruits. Oh, and crucially, make absolutely sure you're taking a daily folic acid supplement. But hey, this is a team effort. Let's pivot to the guys for a second.
boosting sperm quality takes some strict discipline. Men, you need to avoid smoking, completely eliminate alcohol and recreational drugs, and, very practically speaking, avoid wearing tight underpants. Just like for the ladies, maintaining a healthy diet and a regular exercise routine are absolute musts to create the optimal biological conditions for conception.
All right, Section 4, Intimacy without the stress. It is time to reduce the pressure. Take a look at the recommended approach here, having sexual intercourse 2 to 3 times a week, specifically between days 7 and 21 of the cycle. For a typical 25 to 35-day cycle, that is perfectly adequate. Now, what's not recommended? Obsessively using those ovulation prediction tests or tracking apps. Dr. Adagain notes that these tests don't perfectly pinpoint ovulation anyway. And worse, they put the man under intense pressure to, perform to order. For a lot of guys, that pressure acts as a massive passion killer and a strict libido depressant. So keep it natural and consistent.
Now, you might be asking about longer cycles. If a menstrual cycle is consistently longer than 35 days, this usually points to what's called anovulation, which is basically a failure to ovulate. You can't just try harder to fix this. It requires a specific medical diagnosis and likely fertility tablets to boost ovulation. But there is a huge caveat here. Fertility tablets should only be prescribed if the sperm quality is verified as good and the fallopian tubes are confirmed open. Otherwise, it's just the wrong tool for the job. We also really need to talk about stress, which is a major theme in Dr. Adagain's compass. Biologically speaking, high stress levels are terrible for fertility. When you're stressed out, your body stimulates the secretion of hormones like cortisol and adrenaline. Both of those exert direct negative effects on your fertility. Combining the normal stress of day-to-day living with the emotional distress of delayed conception can simply be too much. So, finding ways to actually relax, reducing work-related stress, and actively maintaining marital harmony isn't just some nice idea. It is quite literally a biological necessity. If you do end up needing assisted conception, don't wait. Consider it sooner rather than later. The recommended treatment paths break down really logically based on your specific test results. Like, if the tests show blocked fallopian tubes or poor sperm quality, then IVF, in vitro fertilization, is going to be your best treatment path. However, if the tubes are open and sperm quality is good or only has mild abnormalities, you can look at lower tech options. These include simple ovarian stimulation with ultrasound tracking or IUI, intrauterine insemination. Your test results will clearly map out your medical next step. Which brings us to Section 5, balancing faith and action, because as we know, nothing just happens. So the crucial point is Dr. Adagain's core formula right here. Faith plus action equals manifestation. It's the understanding that nothing just magically happens. If you are praying for a child, that prayer absolutely has to be backed up by actively seeking medical intervention and making those serious lifestyle changes we outlined. As the source material beautifully puts it, you may be waiting on God when God is actually waiting for you to take action. And I just have to share this exact quote from Dr. Adagain because it is surprising, kind of humorous, but honestly so practical. Don't do all-night prayer in church when you should be sleeping with your husband to boost your chances of conception. I mean, it perfectly captures the balance required here. Spiritual devotion is wonderful for sure, but it absolutely cannot replace the practical, physical, and medical efforts required to conceive.
Which brings us to the end of our explainer today. Never give up hope, guys, and keep trying. But I want to leave you with a provocative question. What is the very first action step you will take today to navigate your TTC journey with confidence? Are you going to book that appointment with a qualified gynecologist? Will you finally ditch the ovulation app to reduce the pressure? Or will you review your lifestyle habits tonight? Choose one definitive step from this compass, advocate for your care, and start moving forward today.